I'm Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, we are discussing something very timely and important. We know that we have the Olympics going on right now, and something has surfaced that we should have probably been paying a lot more attention to for a while now. And it's very inspiring that it is receiving so much attention from the whole world. And so this episode is titled More Than Medals in Mental Health Care and Sports Psychiatry with Dr. Greg Mattingly. I have the privilege and honor of interviewing Dr. Greg Mattingly. Welcome to our show.
Thank you.
My first question for you is, why is mental health such a critical component for athletes, not just for their performance as an athlete, but their overall well-being?
We know for all of us that mental health care has never been more important. And it's easy to think about the physical demands of being an athlete, the training, the exercising, keeping your body in tune. But if you talk to any high-level athlete, they'll tell you even more important is keeping their brain in tune. Dealing with anxiety, dealing with success, dealing with failure, dealing with motivation, dealing with the mental challenges of being a high-level athlete.
Mm-hmm.
You know, I think as you and I have heard this year, that's never been brought more to the forefront than a number of the stories we're hearing from this year's Olympic Games.
Yeah. How do you think the stigma of mental health conditions has impacted sports, especially highly publicized sports such as the Olympics?
You know, I think for many years there was a lot of stigma. We expected our athletes to be the cover of the cereal box, to be the head of the commercial, to be somebody we looked up to, instead of realizing, they're all people. We all have our shortnesses, we all have our weaknesses, we all have our blind spots. And so I think there was a lot of stigma about mental health. This is a weakness in somebody that's not supposed to have weakness. Right. One of our cases, we'll use Simone Biles. During the Olympics down in Brazil, somebody outed her for taking a medicine for ADHD.
Wow.
Outed. She had told her physician, it had been approved by the Olympic Committee, but it became a news story that here this superhero actually had ADHD.
Wow. Yeah, that's amazing. I think it's such an interesting point to say that we, as the general public, look up to these athletes as superstars, which is one way of thinking about them, but that doesn't mean they're not human. And that doesn't mean that they're free of mental health conditions. And it's interesting just to see that and in the general public to these things, especially these athletes coming forward more. Why is it so important that many Olympic athletes are speaking out about the importance of mental health, and how can people spread more awareness for mental health conditions in this vulnerable population, not just for these elite athletes, but maybe even parents whose children are in competitive sports or children who are working toward professional sports?
Yeah, I think athletes give us a microcosm of both the successes, but also the stumbling blocks and sometimes the failures that we can occur throughout our lives. So we see athletes that do amazingly well, they get awards, they get ceremonies, but for every athlete who gets a gold or a bronze or a silver, there's 20 athletes who didn't.
Yeah.
So imagine training your whole life. You're the best from your country. You're the best from your university. Maybe you're the best athlete that's ever run in a meet that you've ran in. And now you come to a meet and you realize you're 10th, you're 6th, you're 5th. There's a very classic story that's came out of the last Olympics, Raven Saunders. It's a young woman who was a phenomenal track and field athlete. Unbeknownst to anybody, she was battling some depression and anxiety. She was expected to go to the Olympics and win a gold or a bronze or a silver. And I believe she took 4th or 5th. Right. And she talked about having to come back home and look at her friends and look at her family and look at her supporters and feel like she was a failure. Top athletes in the world, one of the top 5 in the world. Yeah. But she had to come home and feel like a failure. So she talks about her battle with depression, her thoughts of suicide, her thoughts of overcoming it, but now being an advocate for mental health care.
And I think what's really interesting with her story is that she had experienced a lot of childhood trauma and had put that on hold when she went into training and all of that. And when she hit that depressive period, it was like she finally got the chance to process those things. And so I think it's important for us to remember that there is such a human element to these athletes and that they are human and they're going through things just like us. And when your whole life is in the spotlight, you don't have the chance to do things in the same way that other people can, such as processing traumas. So yeah, she has an amazing story. What unique pressures do professional athletes and Olympic athletes face that put them at high risk for mental health conditions? You just touched on a few of them. So we know competition and this pressure to perform, but what else can you get at what it's like to be in the shoes of a highly competitive athlete in terms of their mental health?
I think most high-level athletes, they're driven to perform. They tend to be very driven people. They tend to be very competitive people. But that drive can also be their undoing sometimes. I think you can talk to any of the athletes I've worked with, be it people in the NFL, be it people in Major League Baseball, be it collegiate athletes, and most of them can tell you the time they had their first anxiety attack.
Wow.
And maybe that anxiety attack was when they didn't perform as well as they wanted to. Maybe that anxiety attack was the first time they had a physical ailment. They blew out their knee and now they're thinking, what is my life without football? Maybe that anxiety attack is in the heat of the moment where they truly have a panic attack and all of a sudden they become overwhelmed cognitively and have to drop out of a race. So I think that fear of failure, that fear of not performing, and then how do I manage the anxiety that comes with it? A little bit of anxiety motivates me, but if I know it goes too far, it can also shut me down.
And connected to this, how can the media and the press be harmful to elite athletes' mental health? And what are your thoughts on mandatory fines if these athletes opt out of certain press engagements?
I think you just touched on it. In the case that we all know of right now is Naomi Osaka, who this is a young woman, once again, gifted athlete. Everyone says she's a lovely human being to be with, but she struggles with depression and anxiety. When she's in the middle of a tennis match, you'd never know it. She's fearless. But having to go in a social situation, having to stand up in front of a microphone, be in front of a camera, she said, it makes me terribly uncomfortable. Makes me so uncomfortable. I start having anxiety. I start having panic attacks. I start not being able to. When we think about the pressures of being an athlete, that doesn't mean that I'm going to be a gifted social speaker. It doesn't mean I have to be at all. It doesn't mean that if I'm battling depression, I should have to do things that put me at risk of worsening my depression. And so I think she's been a very vocal spokesperson, very out. I was reading an article about her just this morning where she talked about the match that she lost yesterday playing tennis. And she said, I have to deal with both success, but I have to deal with failure. I have to deal with living my life in a place of happiness and contentment and not let the emotions destroy my life at the same time.
What are some ways that Olympic or professional athletes can protect their mental health in the off season? And why is this transition so difficult?
Many athletes are used to the structure of competing. So they live these very rigid, organized, structured lives. I get up at a certain time. I'm in the pool before anybody else goes to class. And then I come to class and then I go back and train again. And their life is very structured and organized. In some ways, it almost detaches them from some of the emotional burden around them. They're training so hard in such a structured way that quite often when you talk to athletes, they'll say the emotions hit me in those down times. They hit me in the off season.
Right.
They hit me when I have a gap. They hit me when I'm by myself. It's in those gaps of time that quite often the emotions will be overwhelming for our athletes.
I know that Raven Saunders talked about that. How has the pandemic impacted many of the Olympic athletes' training, their mental health, and just overall readiness for the games?
With the pandemic for all of us, it's been a period of unpredictable stress.
Oh, yeah.
And if you talk to anybody dealing with anxiety, when you don't know when the end is going to come, you're not sure when the light is at the end of the tunnel, it's quite easy to give up. It's quite easy to get overwhelmed. So I think that unpredictable nature, especially for these athletes that are used to being in control, they're used to structuring their life and knowing when things are going to happen. I'm going to peak on this day because that's the day I have to be at my very best. Now with the pandemic, that's been taken away from many of our athletes. So people that a year ago were training to have their body at the perfect weight to compete in gymnastics.
Right.
They were in the pool doing 2 and 3 and 4 days, swimming to have their body at the very peak performance a year ago, and then not knowing if the Olympics was going to happen at all for a year.
Right.
You know, imagine trying to train for 6 months, not knowing if you were ever going to have the meet.
Right.
I saw one of our men's Olympic volleyball players. He's one of our captains of our team. He's 6'10". He's naturally very gifted, but he had to train by himself for 4 months.
Ooh, wow. Wow. That's amazing. Can you share a little about how athletes like Michael Phelps, Simone Biles, we've talked about, Naomi Osaka, and Raven Saunders have contributed to reducing the stigma surrounding mental health conditions and sparked important conversations surrounding this issue? I think it's so inspiring that they're doing this. And what are your thoughts on this?
I think if there's any good news is that people are starting to speak out about their mental health needs, their mental health challenges, and the importance of getting mental health treatment. Michael Phelps is a classic example. He's a young man who has very significant ADHD. I remember an interview with him, and they were interviewing actually his sister talking and they said, "Tell me a little bit about your brother, Michael." And they were at the pool they trained at, and there was a bench along one side. And they said, "What's that bench over there?" And the sister starts laughing. She goes, "That's the timeout bench." and they said, "Who owns the record for the most time they had to spend on the bench?" She goes, "My brother was the record holder. He was the one that was always distracted, but put him in the pool and he was fearless." Michael's gone on to be a big advocate about mental health care. He's actually invested in online mental health, behavioral health care. So he's become an advocate. He's become a supporter. He's become part of our mental health industry, helping to bring mental health care to other individuals. You mentioned Raven Saunders, and this is the woman who had challenges at the last Olympics, one of the top 5 people in the world, but didn't get a medal. And she's been very honest about her story with depression, honest about her story as a young woman of color struggling with sexual identity and how that complicated her depression. And so the challenge is it can be very complex but holistic and humanistic that athletes have as well. And so I think those have been some wonderful stories to talk about.
Absolutely. What are some of the common mental health conditions in Olympic athletes? And I know you just touched on some of them. And what do we know about the prevalence of these conditions? It seems as if there has not been much research conducted specifically on Olympic athletes. I was just curious what your thoughts were on this.
Yes. So I think we're still in this infancy of how do different sports and different competitive individuals have different mental health challenges. We know that anxiety is probably by far the most common overall. And that can be normal anxiety due to the situation, the pressure, but can also be underlying generalized anxiety disorders, social anxiety disorders. A lot of the athletes will talk about that. I'm fearless when you put me on the soccer field. But if you make me have to stand up in front of people and give a speech, if you make me do those things, it makes me incredibly uncomfortable. I know one of my athletes I work with, we talked about what a gifted athlete he was. He was chosen in the first round of one of the drafts.
Wow.
And when I asked him about school, he got white-faced. And he goes, "Dr. Mattingly, school has always made me so nervous. I was always afraid I'd be the kid that would give the wrong answer because I was distracted, and school's been a challenge, and it's been a real challenge." So someone who on the outside looks like a Viking, he's this big fearless guy, but on the inside, he's had his own sets of anxieties, learning challenges, and ADHD in his case as well.
Can you share with us a little bit more about your role as a consultant for the Major League Baseball and the National Football League?
Certainly. So I've seen during my 37-year career individuals and athletes across every spectrum. Be it the young kid who's learning to play soccer and does well there, but doesn't do well playing baseball because he has ADHD and it's hard to concentrate when you're sitting in the outfield, but he's great when you stick him on a soccer field. Be it the gymnast who is great with routines, but sometimes has performance anxiety. And so helping them to overcome those sets of issues. When you get to the higher levels of competition, I've worked with a lot of university students going away to play Division I basketball, Division I soccer, Division I baseball. And you see that anxiety, depression, substance use, trauma, as we talked about, can be there. Both the NFL and Major League Baseball have developed more proactive approaches to mental health care here in the last few years. There's a group of us that are certified evaluators in the National Football League, where we can see people if they need therapeutic use exemptions, if they need medicines such as ADHD medicines, and you can treat them in a very proactive way to make sure they're getting optimal care. Major League Baseball similarly has a group of us, and in my case, I take care of kids that are in the farm system. These young kids that have just gotten drafted out of high school, out of college, they haven't made the big time, but they're struggling to deal with depression, anxiety, ADHD, maybe childhood trauma, but also be successful living away from home, performing in the Major League Baseball program. So I get involved at that level with them. And I think both of those systems, along with a lot of other athletic organizations, have now, understood the importance of mental health care. One of the things that happened in our last Olympics in Brazil, it was the first time that the Olympic Committee allowed the therapeutic use of ADHD medicines for our individuals with ADHD.
That's incredible.
Up until then, they'd been banned substances.
Yeah.
But they said, this doesn't make sense. If a kid's been taking ADHD medicines, they're 5, 6, 7, it helps their mental health, it helps their physical health. They should be allowed to continue that same medicine the way they would any other type of medicine. So now, as long as you go through the right type of certification, you can take your ADHD medicine if that's been part of your ongoing care.
That's great. And that actually is connected to my next question, which is, what challenges do you face regarding effectively treating mental health conditions in athletes? So, for example, the anti-doping regulations, banned substances, which you just touched on. And so specifically strategies for managing ADHD in athletes during competition. Can you share a little bit more with us about that?
Certainly. So I think there's always skepticism about making sure people aren't using medications or other substances for performance enhancement. Obviously, we want there to be a level playing field, but level playing field doesn't mean a disadvantaged playing field.
Right,
so if I'm someone who has a lifelong history of ADHD or depression or anxiety, I should be able to continue taking my medicine that's being used for medication therapeutic purposes. And so most agencies, including now the Olympics, allow you to come in and see somebody who's certified within the program to get what we call a therapeutic use exemption, where you can continue one of those medications as long as it's ongoing, consistent use. And I'll use the example, Major League Baseball. They want to make sure that if you're taking medicines for ADHD, it's not just game day. It's not just for performance. It should be a part of your life that you take because holistically, it helps you to live your life better. And I think that's the message for all of us. These are athletes, but they're athletes that have the same prevalence, if not even higher, of anxiety, depression, ADHD, trauma. And those things benefit from treatment the way anyone else would.
Absolutely. Is there anything that you'd like to leave us with in terms of what we might be able to do to help this situation in terms of mental health with athletes, be it awareness, education?
All of the above. I think it's breaking through the stigma. It's breaking through the blame, helping people that we all deserve to be holistic and happy and connected and social, be it a young man who's competing for the first time in his life on the global stage, be it someone like Raven, who is a young woman of color who's dealing with trauma and sexual identity, but still wants to compete at the highest level in the Olympics, be it Naomi Osaka, who's an amazing tennis player, but battles with depression and social anxiety. So we want to help all of those people to get holistic care. We want to help remove the stigma so that we can all have the future that they deserve to have.
Absolutely. Thank you so much, Dr. Mattingly, for sharing such great information with us. And thank you for being on our show.
Very good. Take care, everyone.
This episode was brought to you by NEI Membership. The 2021 NEI Synapse Virtual Half-Day Series is included with NEI membership. Become a member today so that you can register for free for any or all of the monthly half-days, in which Dr. Stahl and colleagues will spend the last Saturday morning of each month sharing cutting-edge research and clinical insights on the topics most relevant to real-world practice. Don't miss out. Become a member today. Visit www.neiglobal.com to learn more.